Good evening, everyone. I'm Colonel Jeremy Bell, the Garrison Commander for Fort Campbell. As you probably already know, we had some computer issues. So if it's not a COVID crisis, it's a computer crisis. But we worked it through, and we're back with you right now. So welcome to tonight's Facebook Live Town Hall. We're following very much the same format as we have in the past. We've kind of collected up all your inputs and your questions. We have a few topics that are ready to go. I think for my introductory remarks, I think what I'd like to talk about initially is if you read a lot of the news and you hear what's coming out from the national and state level, you would very much believe that everything is opening back up and then we're trying to return to a new normalcy. I would just ask that we as a Fort Campbell community remain vigilant and that we fight that complacency that when we hear news like this. We still have to do the same procedures on the hygiene side. We still have to do all of the same social distancing that we've talked about in the past. And then I think as a community, we've talked about this several times in the past several weeks, is just making good decisions that protect not only you and your family, but the greater Fort Campbell community, because the decisions you make as a family absolutely affect the people in our community. So for today, we have a few topics pinned a few topics ready for discussion. Before I get into those topics, there's two Facebook pre-taped town halls that we've done, and these are based on your comments and your questions over the last several weeks. We posted them last week. The first was on resiliency and how this crisis really throws our families and our individuals and our soldiers into a crisis. And that Facebook town hall it talks about tools to help you through that crisis, to establish some level of normalcy in your house, establish a rhythm, if you will, in your life. The next was on soldier support issues, so how the stop move has affected our soldiers on this installation. So those are really good starting points if you have specific issues that you want to address in those two specific topic areas. The topics we have teed up for you today is first, we're going to update you on the stop move policies that have recently come out. We're going to talk a little bit about transition to normalcy and some of the initial steps we've taken here on the installation. Then we have a couple BOC-related topics. We'll talk a little bit about training, and then we'll finish up with ceremonies. So with that, sir, I'd like to open it up to your introductory comments.
All right, well, good evening, everyone. My name's Major General Brian Winsky, Commanding General 101st Airborne Division Air Assault and Fort Campbell, and Command Sergeant Major Barker and I just really want to give you a general update of the general situation. So, we're in pretty good shape, and we remain in pretty good shape here on Fort Campbell over the course of the last couple of weeks now, and especially this past week. At any given point in time, we've had about 15 up to 20 cases again on any given day. The real good news is a very small handful of those are active duty service members. In fact, right now it's I can count them on one hand without my thumb and my pinky. So it's a very manageable number, and none of those soldiers are hospitalized. The remainder are part of our civilian workforce, family members of soldiers, retirees or their family members. And again, glad to say that they all, even though they're COVID positive, appears as though they're on a full road to recovery. So that's great news there. Around us in Tennessee, there's been about 7,200 cases, and as you'd expect, concentrated largely in Nashville and Memphis out to the west, Knoxville to the east, and in Montgomery County, about 125 or so, generally in the Clarksville area. Tennessee's going to have a safer at home policy continuation that'll go until at least the end of the month. In Kentucky, just north of the border here, there's about 3,059 cases total across the state, and they're concentrated largely in the north near Lexington and Louisville. Within Christian County, which includes Hopkinsville and Oak Grove, about 82 cases thus far. So you see kind of a plateau or a little bit of a rise in both states. And for us, we kind of came off that peak, and we're keeping it at, a pretty manageable level of around 15 to 20 total cases. Again, a small fraction of those are our active duty service members. So that all tells us that what we're doing on Fort Campbell here and what you're doing and the adherence and discipline you're applying to all the measures really has paid off, really continues to work, and it keeps it so very manageable that when we do get a couple of cases, our medical team, led by our awesome medical professionals there at Blanchfield, are able to mass on it and take care of those folks with plenty of resources to spare. Colonel Bell mentioned so another development this week was the extension of the stop move policy to 30 June. And when we had the town hall last Tuesday, we knew that was coming. We suspected it was going to be until mid or latter part of June. I think we shared that with you, but it has been formally signed by Secretary Esper. So the stop move is going to continue through 30 June. And we'll talk a little bit more about what that means specifically as we address some of the questions. But it's the same basic parameters that have been in place since the 6th of March. But we are really focused on those families, those soldiers that were stuck in a PCS, that had already initiated movement of their household goods, their families, and that was in motion to their next duty station, but they were stuck here, the service member was, and we're exercising requests for exception to policy to get those families linked up to finish that PCS for them. And again, we'll have some more details in the latter part during Q&A as to what exactly the parameters are for that stop move. Another positive development in a DoD-wide policy change was carryover leave will now continue past 1 October up to 120 days. That's great because right as this happened, that was going to be a pretty heavy leave period for Fort Campbell with the Montgomery and Christian County spring breaks and just that time of year where a lot of folks take leave. So what that means is if you have leave over 60 days in a normal year, you would lose that which is over 60 days come 1 October. That will not be the case this year up to 120 days. So that's great news. We continue to deploy Fort Campbell soldiers and units in support of this fight on COVID, the nation's fight on COVID. And just this past week, we deployed, last weekend, Command Sergeant Major Barker and I sent off the 501st Medical Company to Boston. So they're part of that Northeast Task Force. They're an element of the 531st Hospital Group, which remains at the Javits Center in Manhattan in New York City. They're doing great. The 501st is going to do for Boston what the 531st is doing for New York, setting up a non-standard hospital facility in a convention center-like structure, and again, treat both carryover patients from the local hospitals as well as COVID patients, and they're augmented with some other Army and Army Reserve medical units that are helping them out up there. So again, the 501st in Boston, the 531st continues their mission in New York, doing a great job, making us proud. We have deployed a sustainment element out of the sustainment brigade, the Lifeliners, earlier, or the latter part of last week, and then we are also deploying an additional team that are basically going to coordinate sustainment functions in that Northeast area in both New York, New Jersey, and up in the Boston area. 3rd Brigade continues its mission on the southwest border and in Africa, and we've expanded some essential activities, and I'll talk about that for a little bit. As you know, we've been in this essential activity mode now for a few weeks with, again, good results as evidenced by the really low numbers of COVID positive soldiers and Fort Campbell teammates that we have. But we do need to increase some essential activities and the conditions warrant it. We made a few decisions with the advice of our medical professionals, and you've seen and are feeling an increase in maintenance activity across the division and all the units here at Fort Campbell. Our parts that we order for vehicles continue to come in, and we have to ensure that we get them on the vehicles, get our vehicles up and running in as high a state of readiness as they can be. So when we resume training full force, we don't have a huge maintenance backlog right at the front end of that. We've also really focused a lot on aviation maintenance, and as I think just about everybody in the Fort Campbell community knows, our Combat Aviation Brigade has a series of deployments over the course of this summer to Korea, to Afghanistan, to Iraq, and all across Europe. And we have to ensure that they're ready. So we have continued with a gunnery exercise, but we've implemented a number of measures to ensure that the soldiers supporting it are protected, and we're minimizing concentrations of troops to support it. Command Sergeant Major Barker and I visited them yesterday, and it's going incredibly well. And it's going to result in those soldiers being protected throughout the training, and our AH-64 Apache crews being as lethal and trained, as ready as they can be when they deploy to Korea in the months ahead. To give you a general outlook as to what I think the essential activities are going to look like here going forward, as I mentioned, we have a big focus on maintenance right now. So a lot of our sustainers, but a lot of the soldiers across all the units are really focused on that: vehicles, weapon systems, communication gear, etc. Making sure we don't have a backlog of repair parts, and we're getting those applied, and we're getting all that equipment in as good a condition as we possibly can. In May, I think a lot of our training, and throughout April, soldiers have been doing physical training daily, and then some generally virtual training daily as well. In May, I think we're going to be able to transition to some more hands-on training. Again, maintaining dispersion as much as possible, not having large concentrations of soldiers, but we'll be at the point where we'll be able to get some of our equipment out, start training on it in anticipation for additional training in June. We have to certify our squads on, our mortar squads, our tow squads, as an example, on the fundamental gunner skills required, our artillery crews, etc. So there'll be a bit of that throughout the course of May, in addition to PT. And then if the conditions warrant it, we'll likely start some small arms ranges. So generally 1 day long training events where we go out and conduct live fire qualification on all our weapon systems. Again, that's if the conditions stay where they're at now, or even get better. And we'll assess this constantly, and we'll make every decision that we make in this regard with the advice of our medical professionals. Okay, so that's kind of training. Maintenance now, some more maintenance and individual training and hands-on training, and perhaps some live fire ranges in May. And then in June is when we're going to transition, especially with 1st Brigade, 2nd Brigade, and DeVarty, into some collective training where units will be out in the field training and preparing for those 2 brigades JROTC rotations, which are in August and September. Some good news: we're going to open some MWR activities here in the near term. We're going to open hunting and fishing. We kind of got a brief back from the team that runs all of that we'll be able to do it all, where folks can check in, check out virtually. They can even check harvested game virtually, and we can do it with maximizing the social distancing requirements. So hunting and fishing will open in the very near term, and that'll be for all patrons that are allowed to use hunting and fishing here on Fort Campbell. We're also going to open the personally owned weapon range and the trap range and the archery range. And that will be initially for active duty only until we see how the demand is for that and how we can manage the crowd of people that will be there for that. And then as soon as we can and as soon as the conditions warrant, we'll open that up further. We're going to open golf as well, again, initially for active duty only, and we're going to have a lot of parameters on that. The driving range won't be able to be open because of the handling of golf balls, the tokens, etc. We're not going to be able to allow the use of carts, but everybody can execute in a dismounted or with a hand cart. And then there won't be any pulling of the flags or pins. We'll put some foam inserts in there, so as soon as you hit that, your ball's considered in the hole and you drive on. So there'll be specific instructions at the golf course, and that parallels our surrounding communities as well. We're going to consider the Auto Skills Center. We got our preventive medical team that's going to take a hard look at how we would do that. And then ideally, if the conditions warrant it and we can have the safeguards in place, we'll open that as well. Just some things that we want to open up as morale, welfare, and recreation, as the name implies, to provide some outlet, some opportunity for soldiers to do some things, knowing that they've been in pretty much near quarantine-like conditions in some cases for a few weeks now. And that was the general update. Over to Sergeant Major for anything you want to highlight up front.
Okay, sir, I think you captured everything really well there, especially with how we're opening things up and with the training that's going to be upcoming, and that this is going to be kind of a rheostat as we go through this over the next couple months. We've kind of seen the two ends of the spectrum, and we can now kind of operate comfortably within there, and people have a good frame of reference for that. So I look forward to hearing everybody's questions tonight.
Excellent. Well, thank you both for your introductory comments. I'm going to throw it over to Patrick Birchfield, our BOC commander, to give his introduction as well. So go ahead, over to you, Patrick.
Thanks, Jeremy. Again, I'm in a different room to promote social distancing, and try to demonstrate that we, even in leadership, are doing what we're asking other people to do. And I want to say thank you to the community. I kind of piggyback on what Major General Winsky said. We have a relatively low case rate in our protected population, and that is because, for the most part, people are doing what they're supposed to be doing. So continue to do the right thing, and thank you. Your actions make a difference. Just some tidbits as I update some questions that we've had over the past weeks from Bach and other questions that people have asked. So active duty physical therapy, it turns out not everybody knew that this was still open. So in an attempt to promulgate readiness, we do have active duty physical therapy available. Now, some of those appointments may be telephonic or even video, virtual. You may be given one set of exercises to do and maybe observed on that, and then expected to do it at home and maybe checked in telephonically. But we do have the ability to rehabilitate active duty soldiers. Those are generally at Burden LaPointe, so make a phone call if you need that service. Another thing that we're changing is that vaccines are available for 2 and under now. As you'll recall, last week I said that was 6 months and under. We ran, through several patients. We saw that it was a safe practice that we could expand a little bit. We had a little extra capacity. As you'll recall, we do that first thing in the morning after the building has been sanitized and is generally as clean as it's going to be. Patients are going to enter. This is at Bird Clinic, of course, on the left side there, which is a side that nobody who has an illness would enter for any reason. So we have a little extra capacity in that safe, clean area, and we're going to open that up to immunizations for ages 2 and under. That's a change. As far as our outpatient clinic goes, updates there, the triage line, that's still running. Remember, if you feel like you have COVID symptoms or even cold and flu symptoms you want to make sure aren't COVID, you're supposed to call either the nurse appointment line or the appointment line in general. If you do that and you're directed to, you're sent through to the COVID triage clinic. Remember, we have specific providers set aside only to talk about your COVID concerns. That's open from 06 to 2100, 7 days a week. Now, as I've analyzed the testing that we've done over time, there's a very clear pattern that appears. Mondays and Tuesdays, there's a lot of testing. Slowly goes down on Wednesdays, Thursdays, Fridays, especially if it's a Donza, Saturday and Sunday have very low amounts of testing. Now, either magically folks aren't sick on the weekends, or they don't understand that we provide that service 7 days a week. So if you're feeling bad on the weekends, I would just like for you to know that the same service is available 7 days a week. And after you've called that, and if you get an appointment and you use our drive-up service, remember that's at the C entrance of the hospital now. The tent isn't there right now. If you're tested, if we determine that you're a candidate for testing and you get that nasal swab, you're going to be called every 2 days. Now, for some reason, we don't call you, you call us. All right, and we do, when you pull up and when you go through that entire process, make sure that we have a really good phone number. There are some folks that haven't gotten their testing results or haven't gotten follow-up as desired, and that's because generally the phone numbers that are in their medical records are not accurate and up to date. So make sure that you have a good phone number. When we call you, we're going to verify the date that's tested. That's one way for you to know that it's us calling you. And we're going to ask you for our normal patient identifiers, which you should all know is your full name and your date of birth. That's how we know you're you. And that's a good way to make sure that you're talking to us, you're trusted providers at the hospital, and we're talking to the correct patient. Once we go through that, we're going to check up on you every 2 days until you're well. If you are sick and need further evaluation and you've pulled up to that C entrance there, we do have the ability to bring you into the Air Assault Medical Home. We can do any additional testing that you need. We can even do x-rays, we can do blood tests, we can do breathing treatments, that kind of thing. So it's a good setup specifically for COVID. No other, any other else disease state should be in there, so we're kind of keeping the sick people all together. And we've talked about that for the past several weeks. Just a couple updates there. And we still do not have online testing capability, or rather on-site testing capability. Now, the good news is it's coming. we will have on-site testing capability, but I'm not super worried about that. And the reason is because our contracted testing turnaround rates have decreased drastically. As you'll recall, at the very beginning, we were looking at well over a week, sometimes up to 12 days. That's steadily decreased, and on average, we're at about 2 days now. There's a few outliers that are 3 and 4 days old, but in general, it's less than 2 days. We will eventually have on-site testing, though, and that'll be really convenient for us. We also have the ability for some quick turnaround tests, just a few of those, and we generally reserve those for patients that are sick in the hospital or for healthcare providers that we want to make sure that we can get back into the fight as soon as possible. And as a reminder right now, there's not really any reliable or approved antibody testing, and that's nationally. Interestingly, Army labs are at the forefront of the research going into developing those, and we'll certainly let you know when that happens, and we'll try to get it here as soon as possible. Remember, if you're active duty, we are your MTF. We are your provider of choice. And so if you need testing, please come here. We'll take care of you. And if there's a lot of doubt about that, we use the CDC guidelines about who we test. But if there's any doubt whatsoever, we're going to end up testing you if you're active duty. Another thing I want to highlight, and I mentioned this last week, but I want to highlight it again, and I want to add a little twist to it. So remember, I talked about out at Bird Clinic when we're seeing patients, we want to make sure that people with chronic or complex disease states continue to get the health care that they need so that their health doesn't degrade and make them more susceptible to diseases such as COVID-19. Diseases, for instance, diabetes, CHF, COPD, asthma, ADHD, anything like that that needs, that's chronic, that goes on over a long period of time, that you traditionally check in with your physician or your provider to make sure it's going in the right direction, or even some behavioral health issues. What I want to offer to you is that not only do we provide that service, but we're providing more and more and more virtual appointments. So between 50 and 100% of all provider templates are actually virtual right now. That means every provider has at least 50% and some up to 100% virtual templates. You can actually go on TRICARE online and book those. We're going to ask you 2 questions. Number 1, back to that good phone number, we need to be able to contact you. And do you understand that this is a virtual visit? Now, if you need a face-to-face visit, when we call you, you can say, hey, I think I need a face-to-face visit, and you can have that negotiation with your provider or the nurse that calls you. But if we can accomplish what you need to accomplish through a virtual format, what we're going to do is get an email from you. And then we will email you some instructions on how to download an app. There's a lot of apps available. We've chosen Adobe Connect. And then you can have an actual, almost like a FaceTime or a Skype, or it's just like those types of platforms. This one's Adobe Connect. And you can see and hear your provider, and you can have a discussion. You can show them, your rash or anything along those lines, and you can take care of your health care just that way. We've done that with several folks already, and let me tell you that the patient satisfaction is pretty high on that. People really enjoy being able to get their health care needs taken care of in a virtual format, not having to come down and potentially expose yourself to COVID-19, because this is the hospital is where we bring sick people, right? So here's the takeaway on this. Right now, only about 1/2 to 2/3 of those appointments are filled. So if you get on it, you'll be able to get an appointment pretty quickly, and we encourage you to do that. I think that's the general update overall for Bach. We can come back if there are any questions, and I appreciate it. Back to you.
Thanks, Patrick. Great insights for sure. So for our first question, I think we'll kind of dovetail into the CG's comments earlier about the stop move. And CSM, this question's for you. It's kind of a 2-part question. So Tana has asked, they've been waiting for over a month in their current PCS posture, and they're wondering what's next for them, what's the next several steps. And then Brian asked for those inbound AIT soldiers that we're getting, what's next for their families? So their families are not traveling with them. What's the Army going to do to bring them back together?
Okay, so it's a great question, and I know it's on a lot of people's minds, especially as we approach the summer move season. So for those families that have got caught mid-stride in their PCS move with their household goods or their vehicle shipped out right in the midst of this crisis hitting. The exceptions to policy are being submitted this week, and that should be initiated by the individual soldier through their chain of command, and those are getting pushed up, and the majority of those are getting approved. And now that's for those folks that were caught mid-move when this thing happened. Now there's folks out there that may have had a report date in June or July. They're still in that limbo phase of waiting until we get past this 30 June stop move date. And for the exceptions for those folks, we're waiting on some guidance. But right now, what it's looking like is it's going to be key leaders that we're going to move first, whether it's a battalion commander, command sergeant major, or above for those types of positions. We're also looking at those majors getting ready to go to ILE this summer. Sergeant majors getting ready to go to the Sergeant Majors Academy, and then some of those key positions across the staff as well. So those will be coming down, and those will be kind of directed on which moves we're going to make as we kind of start coming out of this and turning the move switch back on a little bit. So that's the answer for that question. The second question with the AIT soldiers, right now we're trying to minimize the exposure, and obviously there's a lot of risks that's incurred with moving a family. And so for the time being with the individual soldiers, and it really depends on also where these soldiers are coming from and what rules were put in place on them as they transition from a TRADOC installation to Fort Campbell. And so the majority of these soldiers, though, right now are coming here without their families because we're moving them trying to isolate them from exposure to the outside elements, so we don't incur that 14-day quarantine, which we definitely don't want to incur with the soldier just brand newly arriving to Fort Campbell.
Absolutely.
So when the time is right, we'll look at bringing those families forward. But for the time being, those soldiers and their families are entitled to their entitlements as far as BAH for their home of record and so on.
The advantage to that, the plus to that is the soldier has some time to get familiarized with the area, really
Right.
find a good place to live, whether they decide to try to live on the installation or off. And, there's not that pressure of having the entire family cooped up in a hotel room, and they'll have time to do that and find, suitable accommodation or housing for their family, and then call them forward as they would otherwise.
That's true. Yeah, there's always a silver lining. So for Tana, Brian, and Brian, as well as some of the other folks here on Facebook that have posted similar questions, what I'll tell you is the pre-recorded session, Facebook's town hall session that we did last week, is a great first stop for you. So the way we've done this is the topics generally that were discussed were transportation, the stop move, legal and ACS services, exceptions to policies, personnel actions, and then entitlements. And the way we've broken it out is we've given those titles and then what specific points of time that those are discussed on that Facebook town hall. So you don't have to go through the whole thing. You can fast forward to the section that pertains to you. Again, a great one-stop shop and a good starting point for some of your issues. So let's talk a little bit about fighting complacency and returning to normalcy. But before I throw it over to you, sir, for just kind of an overview of how you see normalcy on Fort Campbell, what I will say is up front is we're probably going to return to a new normal. We're not going to return to the same normal that we came from. There's still going to be those added hygiene and cleanliness procedures that we're going to go through. I think social distancing is here to stay for the foreseeable future. You talked about early on in your opening comments, we're opening certain activities, and that was the golf, the weapons ranges, hunting, fishing, and then potentially the auto skills. And based on our discussions, I know you're trying to do that responsibly. We're not going to open up CDCs, we're not going to open up gyms, because those are higher risk and they warrant greater considerations that we're not currently in those types of conditions yet. So can you just talk a little bit about what new normal looks like? And then for you, CSM, I'll ask you to talk a little about mission essential manning, how long that's going to go, And you just talked about travel, so that's it, sir. Go
Yeah,
ahead.
I don't know. I don't want to say new normal because it's going to constantly evolve.
Exactly.
We're assessing a lot of this stuff on a day-to-day basis, certainly a lot of things cyclically, week by week, to ascertain where we're at in terms of number of cases. And as long as those remain low, and as long as our testing turnaround continues to improve and ultimately gets to the point where we're able to test right here on post, that's going to be a key breakthrough in terms of what we'll be able to do. But again, I see for the next few weeks, soldiers' daily activities will include physical training, accountability with their NCO, and then they'll have a series of tasks and maybe self-development things. It may be, on Zoom or some platform, going through some fundamental classes with their unit on their MOS skills or soldier common tasks. But we're at the point now where I think we're going to need to shift to some more hands-on training, and that's what I was talking about. If the numbers stay low, and very manageable as they have been for the last couple of weeks plus, and really throughout this whole COVID situation, it's been pretty manageable. As long as that remains the case, the priority is still going to be to protect the soldier, but the long-term protection of the soldier is ensuring they're trained and ready, and they're set to do what they joined the Army to do. So we are going to have to transition to some hands-on training, but as you said, I think the nature of it's just going to be a little different. So if a group of soldiers are practicing load, unload, reduce a stoppage on a Mark 19, there's going to be, as they will, if they're working out with kettlebells together, there's going to be some wiping down and some sanitation, some hygiene in between iterations, and they'll still get the training out of it, but just applying some prudent protections. And that's probably going to be for the foreseeable future, the next several months undoubtedly. And then as we continue to transition, I'm assuming by the time we get to where we're going to the field, we're going to ranges in May, early June, throughout June, the testing ability will be a little more robust and it'll remain a quick turnaround, and potentially we'll have on-site, on-installation testing, and that'll be a key capability and capacity that we'll need to really test large numbers of soldiers if necessary before we transition them out to the field or back.
Absolutely. CSM, over to you.
Sure, I think the new normal. I think that's a tough one to describe, and for our older viewers out there that remember what things were like on September 10th of 2001 and how they changed after September 11th. 2001. That's probably the best comparable thing. I mean, you used to be able to carry a pocket knife onto an airplane. We had bases that were open that you could just drive on and off of without getting checked. So, but that one event changed things pretty drastically for our nation, and we assumed a new normal. And I think we're going to kind of see that with this COVID-19, not just specific to this disease, but really an awareness for other potential health pandemics out there. So I think it's important that we understand that we're just a little more vigilant is what the new normal is going to be to some of these threats that are out there. In regards to the mission essential, though, it's going to change day to day, just as we've been saying all along, depending on what the requirements are and what the mission is for that day and what the upcoming missions are. With the travel guidance that came out from the Secretary of Defense, it also captured that our current scheduled rotations for deployments overseas, those are still staying on track right now. Now, the different combatant commanders, because of this hiccup we had over the last month or so, may have to adjust some things to allow the processes for transportation of equipment and personnel, but that'll come out. But right now, what we're planning for is for all these deployments to continue on. And so mission essential is making sure that all that equipment and all those personnel are ready to go overseas and do what their nation expects them to do, and to be able to come back home safely, and so that they're at the highest level of readiness when they get there. And then also with the functions that are required around the installation, whether it's as our equipment sits and isn't getting used, taken out to the ranges and out to the training areas, the maintenance is going to become very important as we continue going on through this. So it's going to require operators to come in and help with the servicing and preventative maintenance checks on those items of equipment. And so that's going to be the new mission essential tasks that'll be coming out. And then One of the things that's been happening is a distance learning, and I'd really like to recognize, 129 CSB. We talked about the distance learning courses that soldiers should be taking of right now. Right now, their DLC1 completion rate is at 92%. So, really phenomenal what they've done just in the last few weeks of really kind of hunting the good stuff and taking advantage of some of the opportunities that have been out there.
Those are great. So just based on those last couple comments, a couple things hit me. First, having the mindset that we're going to come out of this in certain areas better than when we went in. Mm-hmm. And that's a good mindset to have those creative ideas where you can make ourselves better as individuals, as units. And then kind of key to that is that first line supervisor, those NCOs who are the kind of the key for creativity. And as we kind of head into the back end of this curve, they're kind of the first line of defense too. When somebody shows up to a formation somewhat sick or looking different, then they engage and make sure they get the right help.
Absolutely.
So the next couple of questions are over to you, Patrick. Had a couple questions on major surgeries and resumption of surgeries in general. And then there was a question on masks. But before I go over to you for that, let's talk a little bit about masks for children under the age of 2. That's come up a couple times in Facebook here. So what I would ask our audience for sure is it's always advisable not to go shopping with your children if at all possible. Use your support network, use your family, your friends, your local churches to help watch your children. Limiting the number of people that come to our shopping centers, and that's both on post and off post, it doesn't matter, is absolutely the right thing to do. We need to make contact with this virus with the smallest element possible, to put it in military terms. And then if you absolutely have to come to our stores and PX commissary with your children, folks under the age of 2 do not have to wear and should not wear masks. So we have educated our commissary and PX staff, and they are more educated on this issue, so they won't force patrons to be either turned away or put masks unnecessarily on children. So over to you, Patrick, for any comments on those questions I just asked.
Sure, thanks. Good question, because apparently there is a lot of confusion. So just mask use overall. In general, we realize that you're not protecting yourself when you wear a mask. The kinds of masks we ask you to wear, a cloth mask, what you're doing is you're protecting other people from the droplets that you spread. With that in mind, in common sense, I hope, people should realize that anybody who can't take a mask off themselves, anybody who's incapacitated mentally or physically, or they're very young, they shouldn't have a mask on in the first place because, of course, bad things happen, and so we want to make sure that everybody that wears a mask is able to properly do so. And that kind of brings me around to the N95 mask question. Some people have them. You can buy them out on the market. And the question is, why can't I wear an N95 mask? I don't recommend that you wear an N95 mask unless you're a medical provider doing medical things. Even our medical providers, when we're taking care of people in the hospital, we don't wear N95 masks unless we're doing what we call an aerosolizing procedure, a procedure that would generate small particles that float up in through the air. Because normally, cold, flu, coronavirus are all spread through droplets, and that's very different from an aerosol that floats up through the air. So we only use N95 masks if we're doing something that produces an aerosol. Also, to be guaranteed, if you will, to be efficacy, to have the highest level of efficacy, in order to be truly protective, that N95 mask has to be fit tested to you. So you have to have gone through a training program. You have to take off and put on the mask in a proper way, yet you can't touch it in the front. It has to be stored properly. It has to be disposed of if used in an exposure to the disease. You have to get a new one, or you can actually sterilize them. And so there's a lot of reasons why people are probably getting are not getting the protection that they think they are getting if they wear an N95 mask that they picked up, someplace. It is appropriate sometimes if you're dealing with an immunocompromised person at home. Sometimes doctors' offices or surgeon offices will give out those masks in an attempt for the home care provider to be as protective as they can. But again, it's actually not protecting the immunocompromised patient in that case. So I think it's a little bit of false security, and that's one reason why we don't recommend for just lay folks to use the N95 masks. Back to you.
Thanks, Patrick. There's one good comment / question and then a good question. So I'll start with the comment. With the stop movement in effect, if we love Fort Campbell, can we just stay here instead of PCSing if the delay continues? So I always love that one.
Yeah, I'll tee it up for Sergeant Major. There are some, and you've heard the Chief of Staff of the Army say, if it's appropriate, ask for a deferment of an assignment. But if it's a critical assignment that somebody's going to, that's higher priority than anything that we could plug that person into here at Fort Campbell. It may not be an option. So those are all case by case, and we'll certainly process the request, and if there's a good fit and we can accommodate that, we would. But again, manning priorities are what they are sometimes, and if it's a high priority billet or assignment, or especially if it's a specialty, that may not be in the realm of possible.
Sir, I think one example would be Korea 8th Army. They initiated on their end the ETP for all the soldiers that were coming from CONUS to go over to Korea, because they need those soldiers over there for to deal with the threats that they have, and they certainly can't have a gap in that process. And so those will be coming through. Also, I didn't mention, but drill sergeants and recruiters. We continue to receive soldiers. The recruiters are out there continuing to recruit soldiers. Getting very creative with it, and soldiers are continuing to ship off to our basic training locations. And so that is going to continue to churn as we go through this. And so those will be in addition to those other categories I mentioned in the ETPs for the stop move.
Excellent. I always appreciate those comments because it just highlights how great Fort Campbell is. This second question is from Alexandria. And this is to you, sir, if we have a second wave, will things be locked back down? And maybe I'll ask Patrick on the back end of this to talk from a medical perspective.
No, that's a great question, and that's exactly what we're looking at. Exactly. We are off the high, and we never had significant numbers, so our overall curve is much smaller than the surrounding county, the state's curve is, substantially more per capita cases in the areas around us. So I think that, again, the key is going to be, continuing the measures that we can, and continue the social distancing, the sanitizing, the discipline stuff, which is what served us so well up to this point. And as Sergeant Major said, the new normal is going to include a lot of that, just in terms of how we generally operate. But going forward, we're going to watch it very closely. I think we're going to see things opening up in our surrounding communities in the weeks ahead, and with that will become, a much higher, compared to right now, risk period, because people are going to be moving, and the virus will be moving, and it's just going to transfer more and more. So we'll continue to watch it, and if it gets to the point where it's a concerning curve back up, we'll re-implement a lot of the things that we have done to keep ourselves protected and safe over the last several weeks. So just as Sergeant Major said, it's the rheostat, it's the dimmer switch, and we'll crank it up when we need to, and we'll tone it back when we don't. And again, we got some really talented medical professionals that are helping us understand the science of all this, and every decision we make and every session that we have to talk about this, they're included in front and center in that discussion.
Excellent. CSM, did you have anything to add on that one?
Nothing additional to add to that one.
Okay. So Patrick, if you could just talk a little bit about what that means from a medical perspective.
Sure, it's something that we're all kind of concerned with. Once we come off of these very strict mission essential manning movements, and folks start to circulate a little bit more, do we have a spike in disease? And predictably, we'll have a small spike in disease. We do have the ability, so that gives us a good reason to continue to do the testing, to continue to keep open the COVID clinic, to continue to keep open the line that people can call to test and to monitor and to make sure our population is properly protected. And as we move towards what may be a new normal, the hospital and the medical capability that we're bringing to bear to this COVID problem is naturally going to lag a little bit in anticipation of being abundantly cautious, right? And so as we are looking at the population, both inside and outside of our gates, and we're determining what the disease burden is, we'll be able to turn up or turn down our medical capability as we need to. You know, the good news is because we haven't had this huge wave of disease, we've been able to continue our planning and continue our training. And we have a very solid plan to expand the hospital and take care of sick patients if we need to do that. Our team is trained and ready, and they're much like many soldiers right now. They're doing a lot of training that they don't normally have the opportunity to do, and in some cases we're going to end up better trained, especially with regard to critical care and intensive care medicine, than we have been in a long time.
Great. I'm going to stay with you, Patrick, because I think some of what you just talked about kind of works into this next topic. You've been recognized kind of Army-wide for some of your practices and training. And I was wondering if you could talk some of those good news stories for our audience, just so they have awareness.
Yeah, you know what? Your audience needs to know, our audience needs to know, we need to really understand how proud the Fort Campbell community should be of all the hard work that both the garrison and the medical community have done. In fact, so we talked in the past weeks about some of the training that the hospital has done with regard to taking nurses that are normally outpatient nurses and giving them some training in the inpatient arena, and taking inpatient nurses and giving them some training in the more intensive care or critical care arena, trying to re-blue them on skills they perhaps haven't seen in quite a while, and then incorporating actually the flight medics from the cab and other medics from the division and lots of other partners into that training. And there was a call for information by another element in the Army Medical Department. So we said, sure, we've done some training, we'll send you what we have. And it turns out that it was recognized as being some of the best training in the AMED, and it was highlighted in a particular publication of the AMED as a best practice and for other people to try to emulate. So we're particularly proud of that, just because of not only the way that we've taken people out of their comfort zone and moved them in preparation for this disease, but in the partnerships that we've developed with our division partners and other tenant units as we've come together to take care of the community.
Thanks, Patrick. You've been about as flexible and resilient on this as anyone I've seen. So thanks for all the efforts that Bach has gone through to reorganize, reposition, and ultimately face the virus and its challenges head on. So last topic, sir, is ceremony. So what I'd like is, I'll throw the first question over to you. This is about the high school graduation that's throughout, and then over to you, CSM, for ceremonies for the military side.
Right.
Changes of command, et cetera.
So, so DODEA, we had a number of sessions and again, our medical professionals included, and with their advice, DODEA has developed a plan for the graduation ceremony for Fort Campbell High School and Fort Knox High School. Our plan is aligned with the types of commencements that the Montgomery County, Christian County high schools will have. And we'll get the details out, but they have a pretty good plan where they'll individually invite the seniors to the school and in cap and gown go through a sequence of actions that include the equivalent or a rough equivalent of crossing the stage, receiving their diploma, transitioning their tassel, tossing the cap in the air, and then with what they wouldn't have in a normal ceremony, a 30-second shout-out opportunity to thank their friends and family that have contributed to every success they've enjoyed, including graduating from Fort Campbell High School. So we're going to do that on the plan, or we'll have that prepared for play on the planned graduation date. So it'll start, I think, the 4th.
The 4th, yes, sir.
And continue, and we'll kind of set it up appointment-wise so we don't have a big concentration of students that are going through this at the same time. And then we'll leave open the option to conduct a traditional commencement later in the summer if the conditions warrant. But again, what we were just talking about is what if this thing kind of is like a sine wave over the course of summer and into the fall. What we don't want to do, and we want to do what has served us so incredibly well over the last 6 or 7 weeks, which is the protections that have resulted in us having an absolute manageable small number of cases. So that's our first and foremost priority. But if we can do something later in the summer, and I can't promise that we will, we'll look to do a traditional commencement event then. But again, I think what Fort Campbell High School has put together is going to be a first-class venue to recognize the graduating seniors from the Fort Campbell Falcon High School.
Yeah, and DODEA is actually using this template for all of their other commencements around the world. So absolutely a lot of great work went into this. And
I will say the Dunn Center, the venue
exactly.
is not going to allow
That's right.
graduations there as well for all the same reasons. And again, I know we can configure everybody in a dispersed fashion, but there's just choke points and there's concentrations of people naturally when you try to do something like that. So when the time comes, and with the advice of the medical professionals,
That's
we'll
right.
consider something. But right now, the planned venue of the Dunn Center is not an option.
That's right. And the other part of a graduation is it's a natural congregating
Right.
ceremony, right? So it encourages people to travel, which is exactly what we don't want to have happen
That's right.
now.
That's right.
Absolutely. So over to you, CSM, for kind of the last topic before we go to closing remarks.
Okay, so for the ceremonies, for the military ceremonies, it changes the command, changes responsibility. What we've done is we've gone virtual for them for the most part, and so we'll have the incoming and the outgoing commander or first sergeant or CSM and what they'll have their families there, obviously spaced apart. The commander that's presiding over the ceremony, the colors, and then they'll be able to go through all the events, but without the formation of soldiers in the backdrop standing at parade rest. So the formation will still be able to tune in on Facebook Live or whatever they're running the feed through to be able to attend the ceremony and take part in it, and obviously no reception at the end either. So those are the adjustments we're making for the time being. It's unfortunate, but it's not worth losing somebody over for the sake of doing a ceremony.
Yeah, absolutely.
Same thing for re-enlistments, promotions, award ceremonies. We did a pretty innovative retirement ceremony last month where we kind of cycled them in by echelon
right.
to keep dispersion and prevent concentrations. Again, the appeal to the units are smart decision making on all of that. We certainly want to recognize people's service with awards. We want to recognize the change of command or responsibility of a unit. We want to recognize the soldier's commitment for 4 more years in the Army with a re-enlistment. But we just got to be smart. We can't. The last thing we'd want is to squelch that celebration with someone getting sick.
That's right.
So.
Thanks. So for my closing remarks, as always, thank you very much for your attendance to this Facebook town hall. I really enjoy the comments, and as we've had in previous Facebook town halls, we have a team of folks that are watching and posting answers to your questions throughout. If you didn't get your question asked or answered during this session, we will, of course, answer those questions over the remainder of this week, point to point. We'll also post this Facebook town hall after either tomorrow or the next day, so that folks have a chance to refer back to it. I especially appreciate the kind of the self-policing comments and everybody trying to inform each other on what's been said before or what policies are out there. So thank you for that. Obviously, you are a well-educated audience, and obviously that's because of the panel members that we have that have informed you throughout. So CSM, over to you for closing remarks.
Okay, thank you, sir. I appreciate everybody tuning in tonight once again. The one thing I just want to say is we're where we are and able to relax some of these things because we've been doing the right thing for the most part. And so I ask everybody just to continue to do the right thing. If you see somebody that's not doing the right thing, give them a reminder. They might not know. We're changing things so quickly that it's hard for people to get all the information as quickly as it's coming out. So a reminder won't hurt anybody. And then have patience, because again, it's a tough time that we're all going through here, and we'll get through this together.
Great. Sir, over to you.
Yeah, so I'd just like to thank the entire Fort Campbell community, all the units, all the family members, all of our civilian workforce, our retirees, their family members, the entire Fort Campbell team of teams for everything that we've done up to this point. And again, you know, we're at this now for about 5.5 weeks, and we've never, you know, got to where it was remotely unmanageable. And that's a testament to the discipline and adherence to the standards across the board, the professionalism of our medical community. Everyone should be rest assured and have a high degree of confidence in our medical team. They are prepared. If this thing were to expand in a significant way, they are absolutely prepared to take care of our entire population. So really proud of everything that they've done. And again, we got a lot of Fort Campbell soldiers in the nation's fight against this thing, particularly all those forces up in the Northeast and along the Southwest border, and we're incredibly proud of them. And then finally, the 25th Infantry Division did a little morale boosting type effort here over the course of the latter part of last week. And, you know, in the absence of March Madness, they kind of had an icon bracket of all the Army's divisional patches and patches from across the Great Army. And it shouldn't surprise anybody that the clash of titans is between us and that other lower numbered division in North Carolina. So if you love the Screaming Eagles, if you love Old Abe, go ahead and get on our division website and select this coveted icon here as the icon of choice. And we're ahead by about 5,000-6,000 votes. Let's keep it that way for another 24 hours. So get on there and vote for Screaming Eagles. Cool.
Awesome. Sir.
Thanks.
Thanks, everybody.